show you a couple of slides I think that are quite telling. And in thinking about inequality, I thought I would compare the U.S. and gaps between the poor and the rich in the U.S. with Latin America, a region that I'm from. I'm from Peru, but that's known for historically high levels of inequality. And also that has, in recent years, made some real inroads on reducing poverty and even reducing inequality. So if you look at this first slide, it's really a, sorry, this other thing is dinging in the background, excuse me. Okay, this first slide is the difference in differences in life satisfaction between the rich and the poor in Latin America and the U.S. This is based on a best possible life question in the Gallup World Poll, and it is it's a question that asks, compared, think what's the best possible life you can imagine compared to your life. How does your life compare to the best possible life? And place yourself on a 10-point scale. So the best possible life is 10, the worst possible life is 0. So if you can see on this slide, Latin Americans are slightly lower on this question than people in the U.S., and that's because answers to this question correlate very closely with income levels, right? If you have more money, you're going to believe that your life is closer to the best possible life. And the question asks sort of a global reference scale. But if you look, the difference between the rich and the poor on the answers to this question is roughly the same between, poor people score much lower than rich people in Latin America, and poor people score lower than rich people in the United States. But now the story changes when you look at other measures. So if we could go to the next slide, please. Now is stress, which, as Donna noted, is very linked to a lot of outcome, negative health outcomes, among other things. If you look here, people in the U.S. experience much more stress than people in Latin America. This is on a simple yes-no question in the Gallup poll, where 1 is yes, 0 is no, and the question is, did you experience stress frequently yesterday? These questions were developed by Danna, who did these very detailed measures of daily moods, and finds that the single-day questions really capture, are very accurate, and mark very well with the much more intense questions. Well, not only did people in the U.S. experience more stress, but the gap in stress levels between the poor and the rich in the United States is much, much higher, almost double that between the poor and the rich in Latin America. So in both instances, the poor experience more stress than the rich, but the U.S. poor experience significantly more stress, not only than the poor in Latin America, but than the rich in the U.S. So, and the gap between the poor and the rich is quite notable. If we go to the next slide, here is a difference, and this is a question I think that captures, or proxies for belief in the American dream. The question is, do you believe that hard work will get you ahead? Well, here I find this a remarkable difference. Latin American poor and rich are about as likely to believe that hard work will get them ahead, right? So it's a pretty evenly shared belief. If you look at the U.S., the U.S. poor are significantly lower on belief in hard work than the Latin American poor, and the U.S. rich are significant. On this slide, there was a search based on Google Media, Google Media, just common words in poor places to live in the United States and rich places to live in the United States. This was done by David Leonhardt in the New York Times. Well, it turns out the common words in poor places are guns, video games, stress, fad diets, Antichrist, and religion. The common words in rich places were foam rollers, baby Bjorns, iPads, baby joggers, Machu Picchu, and other exotic travel destinations. So the first group, the poor, are living, they're stressed, they're living at the moment. There's not much in the future in their common words, or not much about the future, much less investing in the future in their common words. It's sort of coping, stress and coping, and living by day. The second group, the rich group, their common words are all about investing in their knowledge, investing in their children, exercising, linked to good health. So they're living different lives, and it may be that the poor in the U.S. are just much less able to envision their future because they're struggling day to day, whether it's because they don't have health insurance or because they don't have hope, or some intersection of the two. One last slide, if you don't mind going to the last slide. The other thing I've been working a lot on is when I look at these different dimensions of well-being, one of the things that distinguishes, say, answers to just a simple "are you content today" question, or "did you smile today" question, which is sort of living in the moment, positive affect, a part of well-being that matters. But these big, broader life satisfaction and other evaluative questions capture people's ability to lead the kinds of lives they want to lead, to craft a future, to invest in it, to plan for it, right? Stress plays out in different cohorts. This is a complicated slide, and there's no reason to worry about all the numbers, but it's basically a regression of the effects of stress on life satisfaction or well-being. And if you look at the column, it's the fifth row down, it says experienced stress yesterday. And it has a very strong and negative coefficient on life satisfaction, bigger than any effect, a bigger negative effect than any positive effect of something like income or health or whatever it might be. But if you go down about 4 more rows, we interacted stress and household income, and then we interacted the next row, stress and education level. And there what we find is that if you experience stress yesterday but you're at much higher levels of income or at high levels of education, that very much mitigates the effect of stress. I think because there's a difference between, the slide is called good stress and bad stress. Bad stress is due to circumstances beyond your control. You can't plan ahead. You're just getting through the day. The kind of stress that's highlighted in that Google search. Good stress is stress that's associated with goal fulfillment or objective, pursuing objectives. And, any one of us has experienced that, the stress associated with finishing a paper on time, or the stress associated with trying to write something that's really good, or whatever it is. And there may be stress at the moment, but over the long run, it's leading towards a positive objective. And so I think what we were seeing, and I'll conclude with this, is that we have very different, kind of almost different lives going on in our society. Some parts of society, the wealthy and the educated, are able to plan ahead for the future, to live the American dream, to plan for it, and have all kinds of advantages in doing so. And poor people are really struggling with, ill-being in terms of mental health, with ill-being in terms of inability to plan ahead, and that leads to vicious cycles. And I think these divisions are only going to get bigger if you have a whole cohort that's not able to plan and invest in its own future. And so I've probably gone on too long, so I'll stop with that.
Carol, thanks so much for those very informative slides and the discussion. Here in the United States, we've taken some steps, some of them outlined in earlier slides, to understand better risks, resilience, and solutions that would promote better mental health and well-being. I'm going to give a couple of examples. The first is in Philadelphia, where Sandy Bloom is leading a task force to replicate the work of Rob Anda and Vince Felitti, the adverse childhood events work that we showed earlier, and take the findings to guide changes in the city's policy and program offerings. Another is Massachusetts, where recognizing inequalities in health and well-being and the risks particularly found in urban populations in poverty, Massachusetts has developed a patient-centered medical home initiative that targets very young children and their families. It's really an enhanced pediatric medical home where young children from ages 0 to 8 are screened early for social, emotional, and developmental challenges, and efforts are made to identify not only the high-risk children but their families and integrate at the site of the pediatric medical home mental health clinicians and family partners who work to support the individual kids and their families in a variety of ways, including helping them to access more services in an effort to really blunt the effects of risks and strengthen their capacity to respond to difficulty. I also want to tie back for a minute to the slide from the American Academy of Pediatrics. The National Scientific Council on the Developing Child, and now at Harvard University, the Center on the Developing Child, led by Jack Schoenkoff, they're very much focused on a paradigm shift. And Jack talks about this paradigm shift as one in understanding that health and disease across the lifespan and solutions to that need to involve the knowledge of the fields of neuroscience, developmental psychology, epidemiology, sociology, genomics, biology, and economics. Really, all of these things coming together can create, through new knowledge and better application of knowledge, a foundation for sound mental health and well-being. I'd like to ask Carol a question. Since we've taken some of the steps here in the United States we talked about, your work outlines the relationship between life satisfaction and household income, Carol, and the differences you describe between Latin American countries and the United States are striking. Although the baseline levels do differ between the U.S. and the Latin American countries, in both, low income is correlated with lower life satisfaction. And I'm wondering if you might comment on differences you've observed between Latin American countries and the U.S. in terms of systematic efforts that might help individuals or families or communities where there are high levels of economic vulnerability.
Well, two comments along those lines. One is, I think I would also highlight just the difference in the nature of poverty. I mean, in Latin America, poverty is more about material deprivation, but not deprivation of hope. I think there's much less stigma attached to being poor. There are less racial divisions in Latin America. That doesn't mean they don't exist, but and mainly there's been, and so I think that makes, and there are also much stronger family safety nets. So when you talk about, mitigating risk, that's a built-in giant safety net throughout much of the region, which is very different for the poor in this country. I think here poverty is more associated with stigma, often with discrimination. Our political debate is adding to that. It's sort of there's a very strong current that if you're poor it's all your fault, and on and on. So I think that in and of itself creates a very different experience if you are born into a poor cohort and are possibly inspired to get out of it. It's much harder to be inspired to get out of it. And the differences, I think the material differences between the poor and the rich, the kinds of education they access, the kind of lives they lead, are also greater here, which is remarkable. But as I mentioned, Latin America has made some inroads on policies. So to policies and to your question, I think in about two sets of policies. One is that if people don't believe in their future, you can't rely on incentives that are all about people responding to incentives designed to improve their future. If they are just focused on the day, you need to think about incentives in a way that is compatible with people having high discount rates and a very strong present bias, right? So secondly, So in part, I think about how you structure the incentives, and then the other is how do you mitigate risk, right? How do you create better safety nets? So Latin America's done both very well. In terms of the incentives, they have these conditional cash transfer programs that are designed to, to transfer income to low-income people, but they hinge on, they very much hinge on investments in health and education. So to receive the conditional cash transfer programs, you have to take your children, and they're based on how many children you have, how much income is transferred. You have to take your children to the health post, and you have to have them enrolled in school. So it links the receipt of the transfer, and they are significant in terms of the size of, the incomes of people in poverty and the transfers they receive. I mean, they boost them above the poverty line. But they're linked to investing in their children's future. So they've sort of linked receiving assistance now with, pushing you to get out of this daily living sort of, and to help people, start investing in the future. And they've been incredibly successful. If you just look at the rates of poverty reduction in the countries that have done this well, Mexico, Brazil, Peru, Chile. Real stigma attached to receiving the conditional cash transfers, right? Versus in this country, being on welfare it's sort of, this is a bad thing, right? And I've been doing some work with a doctoral student of mine and looking at the effects on well-being of different kinds of income, earned income versus, for example, TANF or food stamps or whatever. And what we find is there's a positive effect of earned income on well-being, what you'd expect, but there's quite a strong negative effect of just receiving transfers, and not just government transfers, but even private transfers, right? Getting any sort of assistance. And I think it's because we've built it in so strongly into this concept of everybody can get ahead if they work hard, that if you haven't gotten ahead, if you can't get ahead, you're seen to be a failure. And if you receive assistance, it's a bad thing. Versus the idea that if you receive assistance, maybe it's a safety net, a short-term safety net to help you get beyond a negative shock and move ahead and have a future. So part of it is the simple design of the programs, and part of it, I think, is the stigma and the sort of the debate that we have in this country about it's all about reducing assistance and getting everybody to work, which is, these are all good things, but I think we've gotten to a point where I think there's some real negative effects of how we are implementing our transfer programs, our social safety net strategies. So I hope that answers your question, Donna. And can I ask you a question?
Absolutely.
Okay. Well, we're sort of coming around to this question of emotional well-being from different angles, and I think coming up with similar themes. It strikes me that you're working more from the starting point being emotional well-being, and I'm sort of looking at the starting point being poverty and its links to emotional well-being, and you're looking maybe from emotional well-being to poverty. So I'd like to learn more. You cited work indicating that emotional well-being is a mediator of the impact of poverty on educational attainment in U.S. adolescents and in other countries. And obviously academic achievement is incredibly important to longer-term employment and income levels. I mean, the sort of gap between people who graduate college and don't in this country and their income levels over the life course is tremendous. And that, in turn, obviously impacts life satisfaction. So is there a link between public policies that are targeted towards improving academic achievement and their effects on well-being, or is there an explicit attempt to also affect emotional well-being?
Well, let me respond to that. First, I would cite that there is research. I'll give an example of one study by Schnitzman, Reisel, and Romer that was published in the Journal of Adolescent Health in 2010. They looked at the effects of poverty not only on academic performance, but also on mental health in children and adolescents. And they found, and it's one of several studies, that emotional well-being does mediate poverty effectively despite living in poverty, despite experiencing stress. If kids have more robust mental health and well-being, they attain educational success. And as you said, Carol, there are serious lifelong consequences of failing educationally. I mean, the obvious ones in terms of employment, but school dropout and school failure is also associated with not only mental health problems, but involvement in juvenile justice systems, criminal justice systems, homelessness in the long term. There are a host of negative consequences. And, you know, developing a productive and healthy workforce certainly does start in childhood. And I think if we want to mitigate the impacts of poverty and toxic stress on development, we need to strengthen individuals, communities, and institutional capacity to mitigate the negative effects on health and human development, even on livelihood. And the link back to, you know, the question you asked about academic achievement and educational policy, we have public policy on educational reform. For example, No Child Left Behind. These policies, however, are focused on cognitive development and academic performance. Given the evidence we have that kids with social and emotional problems have difficulty learning and achieving academically, and further evidence of the effects in some cases of genetic and environmental risks on child development and also on role performance as children and adolescents. I think we need to couple our interventions for education reform with our reforms of child health and mental health and towards well-being, really looking at how we can equip children with social and emotional competencies along with learning and performance competencies. I think we need parallel efforts, by the way, to build some of these competencies for adults. But similarly, as education reform focuses also on teacher competencies and maybe even helping parents to coach their children through homework, we need a social and emotional learning and other initiatives that focus on school personnel, but also on helping families and caregivers to develop the competence to promote healthy social and emotional development.
Very interesting.
Yeah, and you know, I see a question from our webinar participants. I'm going to take those in just a minute, but I wanted to ask you one more question, Carol, before we take those. You mentioned in a recent blog post the work of Ronald Anderson comparing people who earn $75,000 or more a year to those whose incomes are below the poverty line. And you found that the low-income group is twice as likely to report chronic pain and mental distress, and actually 3 to 5 times as likely to report severe chronic pain and mental distress as those with more income. So as we work to address the high cost of poverty, what steps do you suggest be taken to reduce risk and build resilience and to address mental health and well-being? We know in developing countries where investment is lower in prevention and treatment of non-communicable diseases that this could be a challenge, and I'm wondering also what economic measures could demonstrate the value of investments in reducing risk and promoting resilience.
Well, good and not so easy to answer question, actually. And also, in addition to Anderson's work, in that same blog post, we found in the Gallup poll, you know, big gaps between the reports of pain, anger, stress, worry, and I think there was one other one in between the poor and the rich in the United States as well. So there, you know, there's just there's obviously a lot of poor or ill health and ill mental health associated with being poverty, right? And how do you sort of tie that into policies to reduce poverty? And then again, in developing countries, these same issues occur. For some reason, I think, I was very struck by the much larger gap in sort of the mental health measures in the U.S. between the rich and the poor than in Latin America. And obviously that's not the poor everywhere, but I do think that there are different kinds of costs to being poor. Indeed, the blog you mentioned was called The High Cost of Being Poor in the U.S., but there are different kinds of costs associated with being poor in different societies. And I think in developing societies where there are more poor people and there's less stigma about being poor, I think there's certainly stress associated with it, but I think there's less of the stigma effect that I think also carries over into the mental health dimension more. That said, it should be, the mental health dimension should be a concern in all places. I think, I think much of the stress that we find associated with poverty has to do with being in constant risk, with constant negative shocks that can just sort of knock you out of the game. If you think about the difference between having a good high-skilled job where if your child is sick, you can work from home on your laptop and you stay home with a sick child, and it's really not a big to drive it to work, but you don't have the cash flow to maintain the car properly, so you're a lot more likely to have the car break down, can't drive to work, same cycle, right? You don't have health insurance. One very simple health shock in your family, again, knocks you out of the game. So how do you, and that has huge mental health costs, right, that constant risk. So, I mean, I think an obvious answer to that is our safety nets are terrible, right? They're just not. The fact that, we're still disputing trying to give more people health insurance in one of the wealthiest countries in the world, when in most wealthy countries, everybody has health insurance. It's just a universal thing. People don't question it, right? So that's a very simple thing for reducing risk, letting people go to the doctor when they're sick without getting knocked into poverty. I think if we were to reconsider our safety net system in a way that, maybe we should look at Latin America's conditional cash transfers, where if you receive a transfer because you're below the poverty line, you link it to investing in your children, and it's not seen to be a bad thing. It's hopefully seen as a fairly positive thing, and making those investments in your children makes the likelihood that those children will also be poor much lower. So I think reducing risk is a huge factor, at least, in every context, but certainly here. And I think, what has been done in developing countries, again, I go back to the conditional cash transfer programs, because it's a holistic approach to assistance. It assumes that health and well-being is part of the whole story of getting out of poverty. And our assistance strategies don't do anything like that.
Thank you, Carol. We have a very interesting question from our participants that might be a good follow-up to this, Carol. The first one is, would you say that differences in stress and unhappiness are directly related to knowledge about the range of possibilities out there? If I don't know how others live and what I'm missing, am I less likely to be stressed and unhappy? This might go to some of the differences between the U.S. and Latin American countries. But
yeah, that's a terrific question. And I'm known in the well-being literature for something called the paradox of happy peasants and frustrated achievers, in which it's what really got me into studying well-being, which was when looking at people with a lot of upward mobility in Latin America first, and then China, Russia, who were having making large income gains, but reported their situation was terrible, and looking at very poor rural people who had had no change at all and said their situation was fine. And that had to do with raised expectations. It had to do with, all of a sudden, some of those income gains had to do with migrating to cities and seeing how everybody else lived. And so all of a sudden awareness of how everyone else lives. And that's a huge channel for stress. So we did another study of the access to information technology and well-being around the world, in which we looked at access to cell phones and the internet and television around the world. And we found that there were modest positive effects on well-being in the developed economies, except for television, which had a negative effect, because people that watch too much television are unhappy, they're isolated, whatever it might be. But but the real story was in developing countries, particularly Latin America and Africa, where getting access to the cell phone and to the internet creates a new capability, right? It allows you to, assuming that poor people are never going to get landlines in these places, all of a sudden a cell phone allows you to answer a job advertisement instead of having to take a bus to go see what that job is all about. Or in Africa, also e-banking has exploded. People are banking on their cell phones, right? And they're not investing in the stock market, but what they're able to do is get a paycheck and put it somewhere safe and transfer money to their mother in the rural areas or whatever without carrying cash on a bus where it's likely to get stolen, right? It's a giant capability-enhancing thing in countries where people have had no access at all to any kind of electronic cash transaction mechanisms. The internet is huge access to information and all kinds of things that people couldn't have dreamed of before. So what happens? We find that access to information technology has a huge positive effect on life satisfaction and at the same time increases stress and anger, right? So why is that? It's because on the one hand, you've gained capabilities that make your life easier and better. On the other hand, you're gaining huge amounts of awareness about how much other people have, how you live compared to the rest of the world, and life gets a little more complicated. So back to the question, is that more of a feature in the U.S. poor than other poor? I think so. I mean, I think we have so much access to information in this country. Our television shows drum it in, it's all about the lives of the rich and the famous. And in addition, I go back to a point I seem to be harping on a lot, but I've been thinking about a lot. It's also the extent to which poverty has become stigmatized here. Receiving assistance is a terrible thing, it's also, you didn't work hard, it's all your fault kind of mentality. And I think that contributes a lot to the stress as well. So part is, a barrage of information about how the very wealthy live. And the second part is a sort of increasing stigma about being poor, receiving assistance. And probably, I think the other part of the stress factor does have to do with a very fragmented family safety net. I mean, the poor in Latin America have huge familiar support, very much. I mean, it's the most important variable to the well-being of the poor, roughly defined in some surveys we did, after having enough to eat, was having friends and family they could rely on in times of need. In the U.S., poverty is very much concentrated in broken families, single-headed households, female-headed households. The rate of single births in this country, as my colleague at Brookings Bell Sawhill has cited, are phenomenal. So wealth is driven by two-scaled married people raising families and giving them all kinds of advantage. They're at the top of the distribution, and at the bottom of the distribution are increasing numbers of single-headed families trying to raise children amid, obviously very difficult circumstances, and the family safety net is almost nil. So you add up all those factors, big differences between the rich and the poor, a lot of awareness about how the rich live, and then also no familial safety net to fall back on, and stigmatization of being poor. No, it's not remarkable that our poor feel a lot of stress.
Thanks, Carol. I think we're getting a number of questions from people that are responsive to this and some of your comments about the international perspective. One of the questions is that in some societies, especially in Africa, poor mental health is the black sheep that is typically banished and hidden out of sight and out of mind. That is the reality, and there seems to be no policies that address these matters, and yet they have huge implications on poverty and resilience. The writer is asking how the international development industry can address this scenario. I'll make one comment and ask if you'd comment also. Much of the international development work is focused, understandably, on basic public health issues related to securing the water supply, to maternal and child health outcomes, to reducing mortality in that population, dealing with infectious disease, and funding for non-communicable diseases, despite their importance, is limited. I mean, the World Health Organization notes that depression and other mental disorders are the largest factor undercutting economic prosperity and productivity in the developing world, but these investments are not being made. I'm wondering if you have a comment in response to the individual asking about.
Sure, yeah, I do. And then I was hoping to ask you a question, Donna, if that's okay. But just the comment first, and then I'll move on to the question. The comment is yes. I mean, it's incredibly difficult to sort these things out. Not only depression, mental health, but suicide are notoriously underreported in places in a lot of developing countries, right? There's a huge stigma attached to reporting mental health, to reporting suicide in one's family. If we look at the Gallup poll, and we find that, for example, on average, women have higher life satisfaction than men, except in places where gender rights are very compromised. But women also have higher rates of reported depression than men. Now, it could be that women have more emotional swings, but I also think is that in much of the world, there is a very strong norm in which, a man would never report mental ill health, right? Because that would be very unmanly, and then if men commit suicide, you don't see any suicide reports, right? Or if anybody commits suicide, you don't see many suicide reports. So yes, it's sort of an undiscussed problem in a lot of developing countries. How do how do international development agencies get into this arena where they're also running up against strong cultural norms? I think, obviously their main focus has to be sort of on the bread and butter health and education issues, but I do think that this whole new focus on well-being and reports of well-being and is a good inroad into that, because one of the things that we have found when we've done community-level studies of well-being, and that includes not only life satisfaction but stress and worry and these other things, when we do community-level surveys and then we discuss the results at the community level, you get a resonance within the community. Study of life satisfaction and reported depression in China, and we find very high levels of reported depression and low levels of life satisfaction among precisely the people that are gaining and working really hard in the sort of new parts of the economy. Urban people, people who work in the private sector, and people with more education. And they all report not enough leisure time, not enough rest, high levels of anxiety and depression. We haven't released these things yet because it's not finished, but I think some of it is just getting this language into the public domain. If nobody talks about mental health in your country and you're feeling anxious or depressed, you don't know where to go. If all of a sudden it's all over the news that 50% of people in China have reported anxiety and depression, and they work too many hours, and it's bad for and it's linked to bad health and low levels of happiness. Maybe those people who are experiencing these things will be more likely to talk about them. It's almost like you have to slowly change the norm, and I think the well-being metrics are a very good way to do that, because there's a real resonance at the sort of personal level with most people with this data. And then secondly, I know the World Bank has started to think a bit about these issues. Their latest World Development Report is on mindfulness. It's starting to sort of think about kind of behavioral issues much more, and of course that's going to link to these kinds of questions. So, it's a drop in the bucket at this point, but I think it's something that needs to be done, and part, I think a very good first step is just getting these issues into the public domain as sort of what do you want to call it? Banned issues or something, that these are normal issues, that people in all countries experience these things. So with that, let me ask you, I know you all have been taking an evidence-based approach to sort of this whole issue of reducing risk and addressing resilience in your work and addressing mental health issues. What can you tell us? I know we don't have much time left, but can you tell us a little bit about that in terms of everything we've talked about at the seminar?
Yeah. Well, I think there are three areas. I mean, one is the link between quality education and child and adolescent mental health. Another is the link between health insurance and kind of integrated approaches to delivering health care that integrate behavioral health and primary care and behavioral health with other specialty care. And then efforts to improve employment, wages, and offer savings programs and other kinds of incentives that improve the, family's economic picture. This issue of health insurance, you mentioned it earlier, the poor access or uneven access to health insurance in this country creates problems particularly for some of these vulnerable populations. And the typical practice of siloing the delivery of care, whether that's siloing primary care from various kinds of specialty care, but particularly the siloing of behavioral health care, has created difficulties in terms of prevention, early identification, and intervention. You were mentioning earlier the disinclination to talk about mental health issues, the low rates of reporting of depression among males, for example. Another thing that's not really talked about is the relationship between traumatic stress and these mental health conditions. Interpersonal violence, physical abuse, sexual abuse, neglect in childhood and in adulthood are things that are contributing to the high rates of depression and anxiety. And talking about those things is more stigmatized than acknowledging that you have a mental health condition. If we're not able to talk about some of these things and really screen for these events in healthcare settings and school settings, the places where young people and adults appear most frequently before professionals who might be able to link them to some assistance, we're not going to be able to solve these problems. And the lack of health insurance is a huge barrier. In states that have expanded eligibility for Medicaid, targeting people who are at most economic disadvantage, we've seen a dramatic increase in the rates of utilization of mental health services, of treatment for substance use conditions, for example. And these are critical to addressing these problems and really treating people who, as parents, might be challenged in suffering these conditions to parent effectively, for example. We talked a little bit before about the information we have now about the importance of not only improving public education policy, but child and adolescent mental health policy and linking these things together. Again, kids spend most of their time in schools, and we need to make efforts to integrate our policies and address both the cognitive development and the social and emotional development of kids. I know that we're getting tight on time, and I want to pause here to see if we have another question. One of our participants is saying that she is concerned about talking more about the mental health issues and the complexity here and the high rates of mental illness in the population. She's also noting that there are challenges for minority and immigrant populations, and that many of the clients she sees in her practice have trauma histories. And that they are trying to solve some of this through a school-based health model, but being challenged to do so. I think this gets to a larger challenge of how we close the gap between research. We know a lot now about what underlies the risks for negative impacts on mental health and well-being. We know policies that might have a positive impact on mitigating those risks, on promoting resilience, on preventing trauma. But we're very slow to adopt in any consistent way practices that would make a difference. And I wanted to invite you, Carol, as our
don't believe in the American dream. They don't, they're struggling just to get through the day in the ways that I mentioned earlier with no health insurance and risky jobs and all these other things. But we need to think about the incentives that we provide and build into even policies designed to give access to things like better mental health care. Right? We need to get beyond a barrier there in terms of take-up. And I've seen this even with some data on take-up of Medicaid. People who have very strong present bias are less likely to take up even available insurance, right? So we need to think about that black box, right, in terms of there's something going on between what's available and people's take-up of it that has to do with their time horizons and their interest in investing in their future. It's not hard to be interested in it if you don't believe in it, right? And second, back to the social norm point, where there may be, whether it's among minorities or also in different cultures, just a sort of stigma associated with even discussing mental health and mental ill-being. And I think we should really think about using the data that we have from well-being metrics to communicate to people that these things are common and typical, and a lot of families have them, and it's important to talk about them, because if you don't, they can lead to very terrible consequences. So I think in both cases we have a lot of research, and I think we need to think about how is it then that we reach the particular people that we need to reach, which echoes a lot of what you were saying. So thank you very much.
Thank you, Carol. I want to close with one more thought. Our colleague Vijay Ganju, who does work on global mental health, has reminded us in a question he submitted that something Carol has talked about today and we've been discussing here together is that well-being and resilience in developing countries, these things are tied to systems of family and community support. And they play an important role in blunting poverty's impact on well-being. And I want to thank everybody for being with us today. We're very appreciative of your participation. And I want to thank my co-presenter, Carol Graham, for all that she has offered today.
Thanks, Danna. It was a pleasure to be on this with you, and I look forward to maybe collaborating and some thinking going forward as well.
I as well. Thank you.